All right, I think we're going to get started here today. I want to introduce myself. My name is Susan Scott. I am the Business Community Coordinator for Thompson School District, and I'm a member of the Workforce Committee of the NoCo Health Sector Partnership, which is hosting this event. We are recording this meeting today, and after the event, it will be posted on the NoCo Health Sector's website, nocohealthsector.org, and it'll also be linked from there to their YouTube channel so that you can view and share this opportunity with others. Just to give you a little overview of different rules we'd love you to follow during our chat. You probably have some experience with online meetings, but here's a little more, just a reminder for you. Our audience is muted and screens are muted, please. You're definitely welcome to take your video, have your video open so we can see you and our panelists can interact with you a little bit more. Please use the chat box for questions and we will attempt to answer all of those questions, and if there's some that we don't get to at the end, we will attempt to answer those with you following the event. You can also use the raise hand feature and we'll call on you if you have a question that you'd like to ask out loud. And speakers, would love to remind you to kind of keep things a little bit brief with your answers at the questions, but we do have a good chunk of time here today to have this conversation. And let's see, I'm going to give you a little welcome and introduction to what the NoCo Health Sector is all about so you know who this organization is that you're interacting with today. Welcome to the second NoCo Health Sector Careers live virtual chat. Our focus today is on healthcare internships and apprenticeships in Northern Colorado. This event is hosted by the Northern Colorado Health Sector Partnership, which brings together key stakeholders to promote and improve health within our communities. With industry at the forefront, we collaborate with education, workforce development, economic development, and other community partners to seize opportunities, respond to the changing healthcare environment, solve collective problems, and celebrate successes in our region. Like I said, I'm Susan Scott with Thompson School District. Sandra, would you like to introduce yourself as our chat moderator today?
Hi, everyone. I'm Sandra Jackham. I'm with Larimer County Economic and Workforce Development.
Thank you. And we'll hear a little bit from Sandra later about some really great opportunities for high school students this summer. I'd like to get us started just by having all of our panelists introduce themselves, say who you are, where you work, and what your role or occupation is within your organization. I know there's a couple former interns or apprentices on here, so if you want to let us know where you are, where you've been, and where you're at now. Let's start with Lucas.
Hi, my name is Lucas Barrett. I am a certified nursing assistant at Columbine West Health and Rehab.
All right, and remind me, Lucas, you participated in their apprenticeship program, correct?
Yep, I participated in the 2020 fall apprenticeship.
Great. I'll hand it over to Suhas.
Hi, so I'm Suhas. I'm currently a freshman at the University of Pennsylvania, studying sort of biology and business, so sort of healthcare related fields. I participated in the Radiology Internship in the spring of 2020.
Great, thank you. I will pass it on to Holly.
Hello, everyone. I'm Holly Knaubb. I'm the manager of radiology at Medical Center of the Rockies, and I've been involved with the Radiology Intern program since its inception.
Great, thank you. Janelle.
Hi, I'm Janelle Bailey. I'm the administrator of Lakeview Commons Assisted Living Facility in Loveland. And I've actually been lucky enough to have a couple apprentices as well as some interns through this program.
Excellent.
Yeah.
All righty then. I'm going to jump right into our questions, and panelists, please feel free to just unmute yourselves and answer, and we'll just kind of bounce around. Let's see. For those of you that are Suhas and Lucas, who are both former students, I wondered if you could each talk a little bit about what your internship or apprenticeship was like and how that kind of led you to where you're at now.
Yeah, I can start off with that. So I did the UC Health Radiology Internship, and I actually met Holly there too. I remember talking about JAM and stuff before it got cut short by COVID. But it was really great for me there because I got an in-depth look at the hospital environment. So the way it was structured was we would shadow these radiologist technicians, but before that, we would study each of the modalities. So like X-ray, ultrasound, we would present to some of the radiologist technicians, Ms. Capel, and some of the radiologists there. And then we would be able to shadow that modality. And that really was an enriching experience, understanding the technology and the practices, and then directly seeing that when we would shadow them. And for me, I just really enjoy the healthcare environment, seeing the different interactions between all of the occupations, not just the technicians, as well as like the patient rapport. And that's what led me to healthcare and what I'm studying now.
So our apprenticeship, it was structured around having high school seniors and juniors go to Columbine and train as a personal care provider, and then end up working as a personal care provider while they're doing your certified nursing assistant training. And that whole structure worked really well because while I was doing the certified nursing training, I was also working as a personal care provider, which was great to get the experience and to interact with those patients in different ways, and to kind of see what techniques I could use to better work around situations and to interact with my coworkers and complete a task that needed to be completed.
Thank you both. Sounds like those are both really powerful experiences for both of you. I want to kind of connect back with the folks that have hosted these students and these opportunities. Holly, could you talk a little bit about just the radiology internship that UC Health hosts from your perspective as the manager, but also about what different career paths or occupations that the radiology internship prepares students for?
And Suhas, it's good to see you. Glad to see you're successful and going on to college. Yay! Not that I ever doubted you would. So like Suhas says, these kids actually get the opportunity to be on the floor with the technologists when there's not COVID. And it really gives them an idea of everywhere that radiology goes and every type of profession that is interacting with radiology. So even they go over to the ER and they get to see how we do imaging for the emergency physicians, for cardiologists, for all kinds of different areas in the hospital. They get to see, be one-on-one, touch the equipment, see it. They'll do their presentations so they understand how this equipment functions first. So they can really get a good idea of how extensive radiology goes into healthcare overall. And there's so many different areas to go into. Here at MCR, I've got 6 different what we call modalities. So it's X-ray, ultrasound, MRI, nuclear medicine, CAT scan, and interventional. There's also in the OR, mammography is available through UC Health. So there's all kinds of different areas you can go into imaging. And then there's also sales, and there's applications, and a lot of different teaching, management, all kinds of different areas that you can go into after you've finished your X-ray training.
Great, thank you. Janelle, could you talk a little bit about the intern that you hosted, as well as kind of how that progressed? And you're also welcome to chat about working with apprentices within Columbine Health.
Absolutely. So I would say across the board for the interns as well as for the apprentices, it's just a different type of student. They have a zest. They've already identified that they're interested in the medical field, and so they show up for work, for their shift. They're excited to learn more. So here at Lakeview Commons, how we've utilized the internships as well as the apprentice is they work for me in assisted living as a personal care provider. And like Lucas mentioned, that's what they are tasked with until they complete their CNA. And so, you know, they range from just working with the residents for reminders. You know, some of our residents need some more memory cues, and you know, versus the physical assistance. So, you know, they get a wide variety of experience of how they assist our residents. And while they're here, they also get the experience with just with charting, because, you know, most people make it through their CNA experience in most other, you know, fields or their routes of how they go through their CNA classes without even ever having to chart about a patient or about a resident. And so they get that experience before they've even completed their CNA program of the appropriate things of how to chart. And they work a lot with our nurses and with our shift supervisors and our other department heads of you know, what you need to chart, what you need to look out for. So they're just getting so much experience before they are actually kind of thrown out into the real world.
That's great. So many different opportunities to see and experience so many different things. That's really great. Suhas and Lucas, would you both talk a little bit about what you did to prepare for your internship or your apprenticeship, whether it's research that you did or other skills that you took from a job or a volunteer experience or something that you took with you to help you be ready to be an intern or apprentice?
So I can start on that one. So preparing for this apprenticeship, there wasn't a whole lot that that I personally needed to prepare for, other than just being ready to go into a work environment that's professional and you're taking care of someone's life, and you have to be professional in that and make sure that you know what you're doing. And so I really went in there just wanting to learn a lot and to be able to make sure that I know how I'm going to do my job and how I can be the best I can be at that job. Another thing that I would just have to bring in before I got into that apprenticeship was just knowing that this is the start of my healthcare journey. And so me just doing a little bit of research, looking into kind of, okay, now that I have my CNA, what can I do with it now? Like, how can I put that in my own life to start working in the hospital or to start working at a skilled nursing facility, and just kind of researching those positions and learning how I can incorporate that into my healthcare journey.
Yeah, for me, I think, I think for me, one of the great things about the radiology internship was that I did not need much, if at all, any background in radiology because of the way it was set up, where we would all learn and research about the modalities together, all of the various interns, and then by helping each other, we could become prepared that way. So I didn't need to come in with a strong background. I did have some knowledge from AP Physics and sort of the chemistry and the other physical sciences, which helped me. But I had never volunteered at a hospital before, and this was my first time actually like being in a hospital regularly. And the program was just very supportive of that and welcoming, even without much background at all.
It's wonderful to hear. For Holly and Janelle, could you talk a little bit about, I know, Holly, you participate in the interviews with the students that are applying for the radiology internships. And Janelle, I'm going to make an assumption that you're part of interviews with the interns as well. Could you talk a little bit about what you're looking for and what makes a great intern or an apprentice?
Sure, I can start off with that. I'm looking for somebody that has a goal to either enter into the radiology profession or somewhere in the healthcare and use this as a way to find their way of where they want to be in healthcare. Since radiology does go everywhere in the hospital and we interact with all different areas in healthcare, it's a good experience for the student to kind of figure out what they want to do. So I really look for somebody that wants to experiment and really learn how we interact with everything having to do with healthcare, and just somebody that's very motivated and is interested in using what they learn in the program to start their college and work career.
And for me, you know, by the time they come across my desk, I feel like they've already been identified as having a goal to get into the medical field, or at least wanting to experience it, or to, you know, pursue a CNA, or, you know, beyond. So I know that they already have goals established. For me, in working with the geriatric population, I have to make sure that they have a heart for geriatrics, that, you know, I ask a lot about their experience with their grandparents, or maybe with a neighbor. You know, if somebody mentions that they, you know, during this last snowstorm went out and shoveled their neighbor's walkway, I know that, you know, that's going to be somebody who's a good fit for us. And I do have to say that, like, pre-COVID, one of the things that I would look for in interviews is, you know, somebody with a good handshake. Well, we can't really do that anymore, so so that's out the window. But you know, somebody that's just has a genuine concern for geriatrics in this you know, level, but just concern for humanity in general, and making sure that their focus is on the dignity of the residents.
Thank you both. Thank you, former intern and apprentice as well, because I think those are all really good points of how you get ready and what you're looking for. Do we have any questions in the chat at all yet? Just a reminder to our attendees, you're welcome to drop a question in the chat or raise your hand, and we can unmute and chat with you as well that way. For Holly and Janelle, could you talk about if there's an experience in your pathway to where you are now that was an internship or an apprenticeship or some other form of career exploration or work-based learning, and kind of how that may have led you to where you're at today?
Well, let's put it this way. I've been in this career long enough that there weren't any internships when I started in this. My sister was an X-ray and into nuclear medicine technologist. So I had a little bit of introduction through her, but I didn't have this opportunity when I was in high school. I've been a tech for 37 years and I did not go into it right out of high school either. So I love that this opportunity is out here for these kids, and it really gives them an idea of what we do, because I really think even some of the nurses that work on the floor do not understand what radiographers do and what happens in a radiology department and why we ask the questions that we do as far as getting patients ready. So I think this opportunity is wonderful to do that investigation before they actually start college in something that they really don't know anything about.
Yeah, that's an awesome point. Really just getting them that hands-on experience before they spend years in you know, college and beyond, just to decide that, oh, this isn't really something that I'm interested in. For me, my experience is actually pretty similar to that of Holly, and I kind of grew up, I was lucky enough to, I had a grandma who was a nurse practitioner and an administrator of a skilled nursing facility. So down in Arizona, and I would get to spend my summers doing rounds with her, first when she was a nurse practitioner, which I'm sure is not legal anymore, but you know, just getting that experience. And I knew how to redirect somebody with dementia and Alzheimer's before I was 10 years old. So yeah, that was just like kind of a hands-on experience that I got that, you know, not many others received. The other thing that I would say is, through college and through my master's degree, honestly, something that really helped prepare me for the workforce was just, I always had a job and I was always involved in athletics. So there was always extracurricular activities. And I kind of wanted to speak to that too. In my last opportunity to speak was, it's something when we're looking at applicants is what are you involved in? And it doesn't have to be, I'm the quarterback of a football team, or I'm a cheerleader, or it doesn't need to be experience like that. It can be babysitting, just somebody that can utilize their time and time management effectively. And I think that that's a really important piece, especially for high school students.
I would agree with that, Janelle. Time management. The students that have wanted to do the radiology programs, I am just blown away at how motivated and how dedicated they are, and all the activities that they do outside of school and the advanced classes that they take. They've been stellar, and that's something that we look at also, is that time management. That's a really good point. And I also early, before I entered college at all, and you were talking about being with your grandma on rounds as a nurse practitioner, I actually went into the nuclear medicine department when my sister was on call, and would watch her interact with patients and do like emergency lung scans and things like that. Totally illegal now. And especially in the time of HIPAA, there's no way I could do that now.
Times have changed, and that's why I think we have some great opportunities here and processes that we go through to get these students into these opportunities. And we'll be talking about that in just a little bit, about how you can take advantage of the CNA apprenticeship at Columbine, internships with Columbine, other healthcare internships in our community, as well as the radiology internship with UC Health. And we'll talk about the how-to here in just a little bit. I kind of want to ask this question of all. It's kind of a little more for Holly and Janelle, but Suhas and Lucas, you probably have some ideas and tips as well. How do you build your network? What tips do you have for students, Holly and Janelle, or Suhas and Lucas? What tips do you have to people as you're building your network to grow your career?
I would say just take advantage of every opportunity you can, because every step that you take is going to put you closer and closer to that goal that you want to achieve. So any opportunity that you can get available and you can do, I would say go for it, because it is the most important thing to start that early, and to start your goals early and to pursue those goals, because if you don't, then you're going to get behind, and it's just going to be it's going to be more difficult to kind of achieve your goals if you're not taking those opportunities.
Does anyone else want to comment on that one, how you build your network?
Yeah, just to kind of piggyback on what Lucas was saying, I would venture out, get out of your comfort zone a little bit, just to see a wide variety of career options that are available, because you never know, what's out there, what's waiting. And then to also put your feelers out, be proactive, ask for volunteer opportunities. You can identify the areas that you're interested in. For me, yes, I grew up, I love the geriatric population. So when my husband and I moved to Fort Collins 6 years ago, I knew I wanted to be involved in geriatrics, and found out who the contacts were at Columbine, and I had to work hard to get my foot in the door, but now it's absolutely worth it, and I'm doing what I love.
There's also other opportunities even through UC Health, as far as like a one-time shadowing in different areas, in a lot of different areas, in the lab, up on the peds floors. You can ask a lot of questions of the people as you're doing a shadow opportunity. There's also a lot of Facebook groups look for Facebook groups, or just do some internet searches on your own for groups. Utilize counselors, like go to something like Ames Community College or Front Range Community College, any of those places, and get an appointment with a counselor, and maybe get some coaching as far as what's available out there and what it entails, because I know there's a lot of information out there through counselors also. And counselors will have contacts that they can reach out to get more information.
Yeah, I think just adding on to all of that, I'd say don't be afraid to reach out. I know just like there's, especially in college, there's so many professors and guest speakers you're going to meet. And if any of it just sounds like remotely interesting, it can't hurt just to send that email, try to schedule like a virtual coffee chat, and then ask them about like their day-to-day activities. And for me, that's really helped to understand and try to focus on what I want to do by just reaching out, meeting all these people, and that's just a connection you can always save for future use.
Wonderful. I'm hearing lots of questions that you need to ask, and just not to be afraid to ask those questions if you want to know more information. Kind of going off of that one, and this may be some advice you have in that area as well, but what tips can you give students to make the most of their work-based learning experience?
I think for me, what was really helpful was understanding what I wanted to get out of it before I went in it. So when we were researching the different modalities, it was really nice that Ms. Cabell and the Radiology Internship program had it very clearly defined what we should be studying, what we should present, and then just focusing on those as we go through it. And then when it came to actual shadowing, the day before, I would just try to focus on like, hey, what do I want to be looking for? What do I sort of want to get out of this shadow? Because even though it's a fair amount of time, sometimes you just go through the motions and then you look back the day after and it's like, oh, I wasn't really paying attention. It was cool, but now I don't remember. So like focusing on customer or just patient rapport, interactions with like radiologists and different stuff like that can help you just sort of segment and understand just things better about the experience itself instead of sort of letting it slide by.
I would also just add on to that, specific to the CNA apprenticeship. There's a lot of different opportunities in the Columbine facilities. Like there's the dementia patients and the higher level of care patients. And I would say a tip is to just, when you first start, just go through all those areas, try the new areas that you might not know about or you want to know more about, and then start to perfect and go back in and kind of reevaluate kind of, okay, what should I do to better myself in this situation with dementia patients, or how can I better interact with hospice patients, and just kind of perfecting those skills until you've kind of got a range of skills and abilities that you can work fluidly in your workplace.
I would just tag on to what Suhas was saying too. Ask questions, ask questions, ask questions. Don't ever stop asking questions.
For us, it really, the first time that I meet them or the first time that they're in-house, I like to visit with them about what their goals are, and what they're looking to get out of it, like what Suhas was saying. And then as the host, I'm trying to figure out how I can make their experience beneficial to them. It's not just a cookie cutter program. We had one person who was really interested in more of the social service side of patient care. So we made sure that she was kind of following the social service director a little bit more. Yes, she was providing care, but she was also going to, follow and learn a little bit more how to work with social services. And then we've also, one of our apprentice, she wants to be a nurse practitioner. And so I made sure to schedule a time where she was here when our nurse practitioner is here doing rounds, so that she could get that hands-on experience. And I think a goal, or not a goal, but a key to success in this program is just communicating what you want to get out of it.
I like that, being an active partner in your learning during your work-based learning experience. Let's see here. I think what we might do now is have Sandra Jackham with Larimer Workforce talk a little bit about the summer internship opportunities, of which there are some at Columbine, which you heard about today. And then either myself or Joyce can talk about how you apply for the Columbine apprenticeship, which the deadline's coming up quick this Friday. And I'm happy to talk about the radiology internship that's open for Poudre students and Thompson students, and the different ways you apply if you are a member of one of those two districts. So Sandra, do you want to start off and talk about the internships? And there's an amazing amount of opportunities. I'm so excited for you all to hear about them.
Yes, thank you. So I went ahead and dropped a link into the chat box, but the Northern Colorado Health Sector Partnership, who's hosting this event today, coming on this will be the 5th year, they're also hosting a summer internship program. So there are 5 positions. They will be paid internship opportunities that will be open. The applications are open right now, closing on March 31st. So if you're interested, you need to get in and get that application completed. But basically the internship will be worked from June to August, and the positions range from learning some more of that hands-on direct care work to research and administration, to marketing and what that looks like in the healthcare industry. And so across the board, all of the positions are going to put a young person into a healthcare facility, interfacing and interacting with the employees, with doctors, with nurses, having opportunities to do job shadows and things like that throughout the internship. So those positions are posted on the Larimer County Economic and Workforce Development's website. They can be found under the health sector category, but there is another program this year that Larimer County is funding internship positions as well. And you can look through those are a variety of industries, but we do have a couple opportunities that are related, that are in healthcare or related to healthcare. So there's even still, in addition to the 5 positions, there's some other really great opportunities to connect in with this pathway, learn, and have the time to explore the different occupations while getting paid. Keep in mind that these positions are competitive. So bring your A game for those youth that are on the call, have a great resume, answer the interest questions really well, because that's going to be really where you're going to be able to shine and get yourself in the front of the line for these positions. So if you have any questions about them, feel free to drop that in chat. I'll keep an eye on it. But we encourage you all to take a look and check it out and apply and be part of this great program.
Great, thank you, Sandra. Joyce, did you want to talk about the Columbine application process?
Yeah, I think that for everybody that's on the call, if they're all high school students, they have a connection with their high school counselor. And the counselors do know the business process of filling out the application and getting that to us either via email or walk in the application to Columbine's Human Resources Department. And that's the easy part, filling that out. There's a lot of paperwork involved, but does give a good overview of what the program's about and expectations. And then our clinical recruiter will be contacting you for an in-person interview. And then she's been doing that all the month of March. So we have a lot of candidates. And so we will be screening and evaluating and ranking and making sure that we have the top 10 that we want. Right now we do have just 10 slots and we have a lot of applicants to look at. So we're excited to have more this year than ever before. We're also thinking about potentially adding another educator. So we might even have a few more slots, but right now we're hiring for 10 slots for the apprenticeship program to start in August of 2021. So that's kind of the basic steps there.
Great. Thank you, Joyce. And just to add on with that CNA apprenticeship with Columbine, it is a 2-year apprenticeship. So you apply as a sophomore or a junior. typically. Most often those are the students that are applying. You need to be 16 by the start of the apprenticeship, and you earn your CNA certification through that apprenticeship. It is a Department of Labor registered apprenticeship, so that's a national recognition that's kind of added on top of that. And I'm going to drop the link from the Thompson work-based learning page. It's all about the Columbine apprenticeship, so that you fill out a form so we know that you're applying, and we can do a check with your counselor. And Kelly Capel, if you wouldn't mind dropping into the chat how Poudre students should locate it. I believe it is through Zello. That would help us all as well. And let's see. Holly, did you want to talk about the radiology, or maybe Kelly and I should, because it's kind of an internal process within the school districts before you interview with UC Health. Does that sound okay?
I'll let you go ahead and take
Okay. Again,
after the interviews, then I can chime in. But you guys take care of all of it.
Great. With the UC Health radiology program, that is open to high school juniors and seniors at Thompson School District and Poudre School District. There are usually about 8 positions available for at MCR and 4 at PVH. This is an apprenticeship or an internship that starts in the fall, and students with Poudre need to apply through Zello. That's how you'll find this opportunity, is through Zello. Thompson students, it's on our work-based learning page, and will be up with the New Year's application and everything likely this fall. But it is a process where you apply, and then you are screened internally through the school district, and then we pass on the best of the best over to the folks at UC Health for an interview. We'd love to be back in person in the fall for those interviews as well, but it could be possibly a virtual experience. So we're able to help support you preparing for either format. Anything to add on that, Kelly?
No, that's the same process that we will use for Poudre School District. So I think you covered it perfectly.
Typically that internship goes from October to about April. And like Suhas had said, the typical way in a non-COVID year is you research a modality of radiology, do a presentation for UC Health staff, receive some really awesome feedback and some challenging questions, and then you have the opportunity to shadow that area of that modality of radiology, and then you repeat the cycle through all the different modalities. So it's kind of a little bit of research and self-directed study, and a little bit of really cool job shadowing that very few students get to see that part of the hospital. Let's see, am I missing any of the how-tos? Sandra, Joyce, Holly, anyone? All right. Do we have any other questions from anyone? Okay. Well, I want to thank all of our panelists for being here today. Like we'd mentioned before, this recording will be on the NoCo Health Sector site. I'm going to put a survey link in the chat box. Oh, thank you, Sandra, I already did it. Wonderful. We would love to have your feedback on this virtual chat. This is the second one that we've done this year, and trying to help folks in our community do career exploration, and students get to know about all these in a virtual way. And we really thank you all for being here. Our panelists, we have really some really great information, and it's great to have both the business perspective as well as the students that have been through an internship or apprenticeship to talk about their experience as well. So we really appreciate that. And if you do have any further questions, you are welcome to direct those to our NoCo Health Sector folks. I'm going to drop that email address in the chat. If you have any questions after the fact, you're welcome to send an email, and we will try and get those questions answered for you. Thanks so much, and we really appreciate your feedback in the survey. Have a wonderful day, everyone.